So today we'll continue with blood chemistry. We have blood lipids, cholesterol, and serum amylase left. After that, we'll get into blood culture. Now, first of all, coming to blood lipids. Now, cholesterol is one of the main lipids. Okay, plasma lipids will mainly include cholesterol. There will be triglycerides, neutral fats, and phospholipids. All right. Cholesterol, on the other hand, most of cholesterol that is present in a person's body, it is esterified. There is a RCOR bond form between cholesterol, and it will mainly be esterified with PUFAs. Okay, polyunsaturated fatty acids. Last year we studied that whenever cholesterol, most of the time whenever cholesterol is present in your blood, it will be attached to a polyunsaturated fatty acids. Okay, a small amount of free fatty acids can also be seen, and they are generally what do you call, they occur, sometimes they occur in binding with albumin. So sometimes albumin will be able to bind with free fatty acids, sometimes you will see a very small amount of completely free fatty acids. Other than that, you see cholesterol, triglycerides, and phospholipids. Now, as such, whenever you're collecting a blood sample for lipids, let's suppose you're performing a lipid profile test. As such, a lipid profile test is very expensive, quite expensive. So, for that reason, you have to make sure, not that it is only because it is expensive, but it is not performed very often. It should not be performed very often. So, you have to make sure that whenever you are taking the blood sample for it, you have to be very meticulous in it. Now, lipid levels as such can vary a lot. Okay, depending on several factors, they can vary a lot. Now, for example, depending on the recent diet of the patient. Okay, for example, let's suppose today morning is the test. Depends on the results may vary depending on what they had for a dinner yesterday night, or what they had yesterday during lunch. Okay, if there is excessive alcohol consumption, or if there is very very strenuous exercises, ठीक है, if they have performed exercise, very strenuous heavy exercise, या फिर they are on drugs, ठीक है, recently taken any drugs like oral contraceptives या steroids, या फिर any lipid lowering drugs, hypolipidemic drugs अगर लिए, so that will fluctuate lipid levels a lot, and that will not let you assess lipid profile properly. So there are four main factors. Lipid levels vary based on diet, heavy exercise, then there is medications. Okay, medications may mainly you will have hypolipidemic drugs, oral contraceptives. Estrogen messes up with messes your lipid metabolism. That is why the result might be varied. Okay, and steroids, corticosteroids. Okay, uh, right. So these are some of the factors that will affect, and alcohol consumption, excessive alcohol consumption. So as such, whenever you have a patient who is coming to you and telling that I want to get a lipid profile done, make sure that they are not performing any of these four. They are not making any drastic changes in their diet. Okay, they are not consuming excessive amount of alcohol. They are not performing heavy exercises, or they are not consuming any medication at least 48 hours prior to the test. Okay, it is also preferable that you ask the patient to fast for at least 12 hours before the test. Okay, overnight fasting or something like that. All right, they have to fast for 12 hours, and for 48 hours they should not change their normal routine. That is where you will be able to find out what is their at rest, what is their lipid levels normally. If they perform any of these, let's suppose they stopped eating or they eat excessively. Okay, especially depending on what type of food they are eating, or they are performing very heavy exercises, the lipid levels might vary, and you will get a false positive, or you will get a skewed test. Okay, skewed result. Now, as such, whenever you are performing lipid profile, uh, lipid levels as such will drastically vary based on the posture of the patient. Okay, based on how you are making the patient sit and stand, it will vary. So what you do is, whenever you're performing lipid profile, make sure that the patient is seated and they are calm for at least 5 minutes before you are taking the test. Okay, and you have to make sure that you are not whenever you're withdrawing a sample of blood, you will tie a tonic with it. So prolonged venous stasis, if you do it for a very long period of time, what happens is in that area lipids will start getting accumulated. That will also give a wrong result. Okay, so whenever you're tying a tonic wet or something like that, something to restrict the blood flow so that you can withdraw blood during a blood sample, make sure that you do it quickly. If you wait for a very long period of time, lipid levels will increase. Okay, lipid stasis, lipoprotein concentration will increase. Now, as such, whenever collection of blood is done for lipid profile, you do it with anticoagulant. It is generally recommended that it is done with anticoagulant. If you are taking a blood sample without anticoagulant, you have to allow it to clot for at least 30 minutes at room temperature. That is when before you centrifuge it. Okay. Now, as such, whenever you are checking for cholesterol, triglycerides, you determine the sample that you are taking. It can be stored for a long period of time. Let's suppose you take a blood sample for a patient and you know, I specifically want to check for cholesterol and triglycerides. That test can be done after several days. The blood sample, it will have cholesterol and triglycerides for a very long period of time. Okay, for several weeks itself, you can store that blood sample at 15 degrees centigrade. But if you are checking for हाई डेंसिटी लिपोप्रोटीन, ओके, यहाँ पर डिफरेंस आता है. अगर HDL कोलेस्ट्रॉल चेक कर रहे हैं तो you have to what do you call, it should be frozen at 4 degrees, and it should not be what do you call, stored for more than 7 days if you want to check for HDL. Okay, after 7 days the level of HDL will change. So I'll repeat once again: cholesterol and triglycerides, if you're checking for cholesterol and triglycerides in a patient's blood, okay, total cholesterol and triglycerides, then you can even if you check it after several weeks, if you store it properly, it is fine, you will get correct values. But if you are checking for HDL, you should not store it for more than 7 days, and that too, when you are storing it, you have to make sure that you are storing it at around 4 degrees centigrade. Okay, now specifically coming to cholesterol, the normal cholesterol level is around, so just to refresh your memory, total cholesterol. Okay, normal levels of total cholesterol is around 125 to 200 mg per dl. Now anything over 200 mg per dl is a very bad sign. Okay, 200 mg per dl itself is the higher mark. उसके ऊपर रहा बोले तो the patient definitely has some lipid problems. They might already be having atherosclerosis, or they might be on the route of developing, cardiovascular disorders. Normal range for triglycerides, serum triglycerides, this should be anywhere less than 150 mg per dl. ठीक है, you will have borderline patients which are 150 to 199. अगर 200 के ऊपर आ रहा बोला तो हाई ट्राइग्लिसराइड लेवल्स है. Okay, if it is very high, it will be very high. When it is more than around 300 400 के ऊपर है बोला तो it will be very high. Okay, if it is going towards the what you call border of 500 triglycerides, that is when it is very very high. All right, you can be sure that the patient definitely is suffering from some cardiovascular disorder in that case. Then normal HDL levels, okay, serum HDL levels, this should be high. Generally it should be higher than 40 mg per dl, 40 to 60 mg per dl. Okay, not lower than this thing, 40. HDL should be high, LDL should be low. Now serum LDL should generally be lower than 100 mg per dl. This is an average healthy individual. Okay, agar whenever you have fluctuation in values of LDL or HDL, let's suppose the patient has normal LDL levels but their HDL is very low, their total cholesterol will start increasing slowly, because HDL is responsible for moving cholesterol or fat from your body, peripheral structures of your body, to the liver to get metabolized and to get broken down and to get converted. LDL does the opposite. It will take whatever fat is being what you call formed, specifically cholesterol that is being formed in your liver, two various parts of the body. Now, even if LDL is normal, let's suppose HDL is going down, that can also be problematic because relative amount of cholesterol that is present in your uh, blood will start increasing. Okay, LDL is performing its function normally. If HDL is not present and it's not functioning properly, it will ultimately lead to a steep increase in cholesterol levels. Eventually, it will lead to increase in cholesterol levels. On the flip side, if serum HDL is normal, but LDL is very high, that is also when serum cholesterol will increase. Okay, so ideally you would want high amounts of HDL in a patient's blood and low amounts of LDL, triglycerides, and total cholesterol. Uh, Please be sure that cholesterol is necessary for several things. Very low amount of cholesterol is also very bad. Okay, because cholesterol is a precursor for several hormones and several enzymes. You need cholesterol for several biochemical reactions. If you do not have enough amount of fat, that is why, see, sometimes what happens is people go on these crazy diets and they generally cut out all fat and things like that. What happens because of that is your total amount of cholesterol which is required for normal healthy functioning of your body, that also gets skewed. As such, what happens is it will start affecting your body negatively in a different way. So it is not advisable that you completely cut out fat from your body. It is necessary, but again, moderation is the key. Now, you will see moderate increase in total cholesterol, triglyceride levels specifically in a certain conditions. Generally, obesity. Okay, early grades of obesity, or if a patient is overweight, उन लोगों के अंदर triglyceride levels high रहता. As there is weight reduction, it will come down back to normal. If the patient has diabetes mellitus, या फिर alcoholism है, या फिर von Gog's disease है, there is type 1 glucose glycogen storage disease. ठीक है, वन गिल्स disease is a glycogen storage disease, या फिर the patient has nephrotic syndrome, or they are on a certain they are on few drugs that are causing hypertriglyceridemia. Okay, there are certain drugs that can increase triglyceride levels, specifically thiazides. Something like chlorthalidone can increase triglyceride levels, या फिर very high doses of chlorthalidone or very high doses of diuretics. Yeah, very high doses of beta blockers also can increase triglyceride levels. If the patient is consuming ethanol excessively, yeah, if they are on estrogen administration for a long period of time, that can also increase triglyceride levels. Or if they are malnutrition, triglyceride levels will increase. Okay, so that is about blood lipids. Now coming to serum amylase. Now, amylase is an enzyme that is mainly responsible for carbohydrate metabolism, specifically breaking down starch. Okay, mainly it is secreted from your pancreas, but there are some other tissues as well which are capable of secreting this enzyme. Okay, as such, you will find most of the amylase that is being secreted, it is from pancreas. A little bit of amylase from salivary glands, and smaller amount from other tissues. Okay, so mainly found in pancreas, small amounts in saliva and other tissue. If you remember nutrition में जब digestion पढ़ रहे थे आप, digestion of carbohydrates, I'm sure that you must have read carbohydrate digestion starts in your mouth itself. Okay, your saliva has salivary glands has the capability of producing a little bit of amylase where it will start breaking down carbohydrates. Eventually, when it will reach your gut and pancreatic secretions come into contact with your food, that is when pure or higher degree of breakdown occurs. Now, as such, you will have several different types of amylases. Okay, there are several isoenzymes to the amylase enzyme, but mainly there are three types. Okay, alpha, beta, and gamma amylase. So, three main types of amylase: alpha, beta, and gamma. Okay. Now, as such, whenever you see clinically, when you try to estimate serum amylase, uh, it is important for diagnosis of acute pancreatitis. Like whenever a patient is having acute pancreatitis, you will see that their amylase levels is one of the first things that will get distorted. Normal amylase levels will raise. Okay. Now, as such, normal amylase levels, serum amylase levels, serum, one second, level is around 60 to 120 Somyo-G units per 100 ml or deciliter. Okay. What are this Somyo-G units? Now, generally you will find in what you call clinical reports or in your case sheet, it will be written as, what the hell? One second. Yeah, 60 to 120 U by DL, U by L. Okay. So, वो units are Somyo-G units. Now, what is that unit? Somyo-G unit is a unit of measure of hydrolyzing action of your amylase. Okay, normally amylase has the capability of hydrolyzing carbohydrates. So here you are measuring the capability of a single enzyme molecule, its capability of hydrolyzing this thing starch. So specifically agar apan bole what it somyoji is, that amount, one single unit of somyoji will be equivalent to the amount of enzyme in 100 ml of blood. So ye one somyoji unit, okay, this is equal to total amount of amylase in 100 ml of blood, okay, that is able to produce 1 mg of glucose. Okay. Whenever you hydrolyze starches, you will end up getting glucose. So here you are checking how well a particular enzymes, or in this case how well amylases activity in conversion of starch to glucose is. Okay, that is represented in terms of somyogy. How much amount of amylase is required to convert certain amount of carbohydrate. You take a solution of carbohydrate, standard starch solution, and under defined conditions, how much amount of amylase is required to convert that standard amount of starch into glucose in 100 ml of blood. Okay. So normally in your blood, every 100 ml of your blood, there is around 60 to 120 Somyoji units of serum amylase. Now, whenever in certain conditions serum amylase will increase, certain conditions serum amylase will decrease. Specific conditions where serum amylase increases, okay, okay, increased serum amylase, right? It occurs in acute pancreatitis. One of the first tests that you do to diagnose acute pancreatitis will be checking serum amylase. The patient is having chronic pancreatitis, it will be high. If the patient has carcinoma of pancreas, या फिर the patient has some other disorder like superficial pancreatitis, या फिर stones and cancer of, so other disorders, इसमें mainly आता stones and cancers of common bile duct. ठीक है, common bile duct में से your amylase flows out, right? If there is renal failure, it increases, या फिर there is superficial pancreatitis, ठीक है, especially if superficial pancreatitis is occurring from penetrating or perforating ulcers, from penetrating or perforating ulcers. So the patient has a gastric ulcer or any other part of the any other location where near the pancreas an ulcer is occurring, and it is perforating into the pancreas. ठीक है, causing superficial pancreatitis. It is perforating through the wall of that particular organ. For example, let's suppose gastric mucosa है, stomach में sorry gastric ulcer है, stomach में ulcer हो रहा, and that is penetrating or perforating out of the layers of your stomach, and it is affecting the pancreas. Generally, it will cause superficial pancreatitis that will be indicated by an increased serum amylase level. That is a complication of ulcer. ठीक है, because of ulcer complication pancreatitis is occurring. या फिर द पेशेंट हैज salivary gland disease. ठीक है, तो स्पेसिफिकली द पेशेंट हैज मम्प्स. ठीक है, उसकी वजह से salivary gland you know acute parotitis is occurring. Parotid glands are inflaming. Okay, occurs in mumps. या फिर the patient has diabetic ketoacidosis. No, especially diabetic coma. Ketoacidosis का later form जब diabetic coma हो रहा. Now, there are a few conditions in which it will decrease as well. Specifically, if there is a necrotic disease of pancreas, necrotic pancreatitis bolte, the pancreas are literally wasting away, or if the patient has hepatitis, yeah, for there are severe burns. In all of these conditions, serum amylase will decrease. Decrease in serum amylase occurs when there is necrotic pancreatitis. Pancreas are completely wasting away. या फिर the patient has hepatitis, or hepatitis is secondary in a way, in the sense that because of hepatitis your bile ducts and all of those surrounding structures will start getting affected, because of which serum amylase will not be able to come out of the pancreas into your gut. Okay, it might not exactly be a pancreatic problem, but the problem in the transport of serum amylase, or if the patient has severe burns. Okay, in all of these conditions serum amylase will decrease. Now, coming to the next topic, blood cultures. Now, why is blood culture important? Mainly to check for infection. Okay, to check for any other disorder or disease that the patient might be having, for a possibility of septicemia, yeah, bacteremia. Okay, especially one that is suggested by clinical features. Let's suppose the patient is having fever, okay, and you are not able to distinguish. Let's suppose the patient has pyrexia of unknown origin. Okay, you're not able to see any other clinical symptoms. Okay, or you are suspecting that the patient might have a bacterial infection. That is when you perform a blood culture. Okay, especially when you are isolating a bacteria from blood, in a patient with local infection. Let's suppose the patient has a wound where sepsis is occurring. Okay, they have a local wound, superficial wound, and there is sepsis in that wound. Yeah, if the patient has pneumonia, in those conditions blood culture becomes very very important, because it will indicate how which antibiotic therapy which you can give specifically, because depending on the type of bacteria you will give antibiotic. You cannot just initially, you will start empirical broad spectrum antibiotics, but sometimes as you know, several bacteria are resistant to antibiotics, especially to broad spectrum antibiotics. They might not work. You might have to use a very specific drug for that, to get an urgent result, to specifically narrow antibiotic therapy. Because whenever a patient is coming to you with, let's suppose, sepsis or pneumonia, you need to start giving them antibiotic therapy very quickly, and the more specific you can get, the better. Specific in the sense, जो organism है उसके specific आप antibiotic दे रहे, not a broad spectrum antibiotic. So for example, if it is a gram negative bacteria, let's suppose a gram negative what do you call, bacterioid species, which is very very what do you call, resistant to other broad spectrum antibiotics, you have to give a drug that is very specific to that. For example, let's suppose you are giving metronidazole. ठीक है, स्पेसिफिकली एक पर्टिकुलर चीज के लिए काम कर रहा, या एनारोबिक बैक्टीरिया है या वैसा है. ओके, या फिर ग्राम पॉजिटिव है, स्पेसिफिकली मरसा है, दूसरे ड्रग्स काम नहीं कर रहे, सो यू हैव टू स्पेसिफिकली गिव vancomycin, या VRS है, vancomycin resistant है, you have to give linezolid, things like that. ठीक है, it will also help in distinguishing between contaminant and real pathogen. Now, in a blood culture, whenever a patient is having let's suppose wound, वहां पर it can be a pathogen that is entering into the body and causing the problem, and there can be a contaminant as well. Contaminant is not causing the clinical features, it is only contaminating the wound or that area superficially. It has not gone into systemic circulation. Pathogen on the other hand is already inside the systemic circulation and it is dividing. Contaminant is different, pathogen is different. For example, let's suppose a patient has um, let's suppose a patient already has E. coli infection, okay, and upon that they got a superficial wound, okay, and in that wound there is maybe staphylococcus infection. So यहाँ पर the patient will start showing symptoms of E. coli first, ठीक है. So the pathogen in this case will be E. coli, contaminant will be staphylococcus, ठीक है. The again, if it is not controlled, staphylococcus will enter into systemic circulation and it will divide like crazy and it will start showing clinical symptoms of its own. So you have to this blood culture will help you distinguish between contaminant and pathogen, because initially the amount of pathogen will be much more higher compared to contaminant in the blood. Now whenever you're collecting a sample for blood culture, you have to make sure you're taking a few precautions, okay, very important, so that contamination does not occur and you will not make any mistakes. First of all, you have to make sure that your hands are very clean, you have washed their hands completely, and you have dried your hands, and preferably worn gloves, okay. Wear gloves especially to avoid hepatitis B or to avoid HIV infections. You have to avoid you have to wear gloves, okay. You have to disinfect the site, okay, wherever you are performing the venipuncture. Wahan par you apply around 70% isopropyl alcohol in water and 1% iodine, okay. You wait for 1 minute after applying that solution, you wait for a little while, let it dry, and once it is dry, you collect the sample. And when you are collecting the sample, try to avoid unnecessarily touching the wound, okay, because it will cause recontamination at the site of that puncture. Wherever your let's suppose your glove has other bacteria or surrounding needle had other bacteria on its surface, wo contaminate kar dete. Okay, it can happen. So try to avoid touching as much as possible, at least direct contact. If possible, only put a cotton swab on there and tell the patient to hold it, that's it. Don't touch it directly, okay. And you have to make sure that you change the needle while avoiding to touch the shaft of the needle ko touch nahi karna, okay. You will end up contaminating if you touch the shaft of the needle, all right. Be sure that once you have withdrawn the blood, you transfer it to the what do you call culture bottle and give it off to proper authorities with care. Now depending on different patients, generally a certain volume of blood is taken, ठीक है. आप 10 ml लेते, but again in certain conditions you might have to perform multiple blood tests, ठीक है. Most bacterial infections you will not be able to see within 1 ml of blood, okay. You will generally have to take at least 5 to 7 ml of blood, and that too you have to dilute that blood. So whenever you are, for practical purpose, what you will do is so as to avoid your blood itself has a bactericidal and bacteriostatic action, okay. Your blood has WBCs, it will have mechanisms of its own to kill bacteria. So what you want to do while you're performing blood culture is that you should make sure that the blood is not killing the bacteria, because you are trying to check for bacteria. यहाँ पर whenever you are withdrawing a sample of blood, let's suppose you withdraw 10 ml of blood from a patient, ठीक है. The bactericidal effect and bacteriostatic effect of the blood while will interfere with growth of bacteria. That is not good for you when performing blood culture, because you want to see what bacteria is present, okay. And you can neutralize the action of the bactericidal effect or the bacteriostatic effect of your blood. This can specifically done by dilution. What you do is, let's suppose you take 10 ml of blood, with you dilute it in 100 ml of medium. But for practical purposes, what you do is you take 5 to 7 ml and you add around 50 ml of medium. You dilute it around 10 times. If the patient is already on empirical therapy, for example, they are already on broad spectrum antibiotics like penicillins, you will give penicillin Ace so that that penicillin is dead. Okay? You do not want antibiotic to be present in the blood sample that you are taking, because you are trying to check for bacteria. You will neutralize the antibiotic that is already present in the patient's blood. ठीक है, अगर पेनिसिलिन दिए पेशेंट को तो पेनिसिलिनेज यूज करते हैं, अगर लेट्स सपोज सल्फोनामाइड्स यूज करें तो पाबा यूज करते हैं, पैरामाइनोबेंजोइक एसिड। ठीक है, दे आर वेरियस एंटीटोड्स फॉर डिफरेंट antibiotics, ठीक है, because you want to see what bacteria is present in the blood culture. Now, most commonly in blood cultures, you will see a few bacteria. So specifically, you will see Staphylococci, there will be Clostridium perfringens, you will see coliform bacilli, okay, Pseudomonas, you can see pneumococci, okay, enterococci, Proteus, Proteus mirabilis, ठीक है, some species of Salmonella, ठीक है, sometimes you will see yeasts and molds as well, pathogenic yeasts and molds, fungal infections. Okay, so these are the results of blood culture. Whenever you perform blood culture, these are the most common organisms that you will see. Now we'll continue with serological and immunological tests tomorrow. Okay, how you perform serological tests with anti-serum and what all tests are performed and what do you check. Okay.